What if a startup idea could solve one of the biggest problems inside hospitals? Every day, doctors and nurses take care of many patients. They check the patient's temperature, blood pressure, heart rate, and oxygen level. They give medicines, they write notes, they check test reports, and they keep updating the patient's condition. But there is one big problem. There is too much information, and doctors have limited time to go through all of it. A doctor may have dozens of patients to check in one day, but for every patient, the doctor needs to understand one important thing. What has changed? What is better? What is worse? What is new? And what needs attention? Today, finding these answers can take a lot of time. So what if software could collect all this information, understand what has changed, and give the doctor a simple daily summary? Instead of searching through many reports, the doctor could simply see, here is what changed. That is the startup idea we are going to explore. A hospital is not only about doctors treating patients. There is a lot of work happening behind every patient. Nurses check patients many times during the day. They record vital signs, they give medicines, they check if the patient is comfortable. They record new symptoms and other observations. They also update the doctor when something changes. At the same time, test reports are coming in. New medicines may be added, doctors give new instructions, and every small update needs to be recorded. Now imagine doing this for dozens or even hundreds of patients every day. The hospital generates a huge amount of information. The information is important, but someone still has to read it, understand it, and connect all the updates. And this takes time. For a doctor, the problem is not always a lack of information. Sometimes there is simply too much information, and that is where our startup idea begins. Now let's look at the nurse's side. A nurse may take care of many patients in one shift. For each patient, there are many things to check: blood pressure, temperature, heart rate, oxygen level, medicines, pain, food and water intake, and the patient's overall condition. Today, much of this information has to be entered and updated in the hospital system. Our idea is to make this process much easier. The nurse opens the patient's profile. The system already shows the care tasks for that patient. The nurse checks the patient and updates the information. The nurse can enter the vitals, confirm the medicine, and add a short note about the patient's condition. The software then puts all these updates together. Instead of having information in different places, it creates one simple timeline. For example, at 7 in the morning, the vitals were recorded. At 8, medicine was given. At 9, the nurse added a new observation. Later, a test report arrived. Everything is connected in one patient timeline. And this gives the doctor a much clearer picture of what happened during the day. Now imagine all this patient information coming into one system. The nurse's updates, the patient's vital signs, medicine records, test reports, doctor's instructions, and other important patient information. Instead of keeping all this information separate, the software brings it together. This becomes the patient care intelligence engine. Its job is simple. First, it collects the information. Then, it puts the information in the right order. It looks at what happened earlier and what is happening now. And most importantly, it looks for changes. For example, yesterday, the patient's oxygen level was normal. Today, it has gone down. The patient's temperature has also increased. The heart rate has changed, and the nurse has added a new observation. The software can bring these updates together and show the doctor. These things have changed since the last review. But the software does not decide the treatment. It does not replace the doctor. It simply helps the doctor find the important information faster, because the final decision should always remain with the medical team. The goal is simple: less time searching through information, more time caring for patients. Now imagine the doctor starting the morning round. Instead of opening every patient file one by one, the doctor opens one dashboard. The dashboard shows all the patients in one place. For example, 40 patients in the ward. 4 patients need priority review. 9 patients have important changes. 12 patients need monitoring, and the remaining patients are stable based on the information available. The doctor can start with the patients who need more attention. Let's take one patient. The system shows oxygen level has gone down, temperature has increased, heart rate has increased, a new nursing observation has been added, and a new test report is available. The doctor can click on each update and see the original information. So the doctor doesn't have to search through many pages just to understand what happened. The system gives a simple summary: what is new, what has changed, what needs attention. But the doctor still checks the information and makes the final decision. The software is there to support the doctor, not to replace the doctor. Now let's take this one step further. What if the doctor could see the complete story of a patient from the last 24 hours? Instead of reading many separate notes, the system gives a simple summary. What happened? What is new? What has changed? What is getting better? What is getting worse? and what is still pending. For example, the system may show that the patient had a new symptom in the morning, a medicine was given, a test was completed, a new report came in, and later, the patient's vital signs changed. All these events are connected in the patient timeline. The doctor can see the important changes first, and if the doctor wants more details, they can open the original notes, reports, and readings. This is important because the AI should not hide the information. It should make the information easier to understand. The doctor can always check the original data before making a decision. So instead of spending a long time searching through the patient's record, the doctor gets a clear picture of the last 24 hours. One patient, one timeline, one clear view of what changed. So far, we have looked at one patient. But what if the same system could help the entire hospital? Imagine a hospital with hundreds of patients. The hospital dashboard can show the overall patient situation in one place. For example, how many patients are admitted, how many need priority review, how many have important changes, how many patients are stable, and which wards need more attention. The system can also track pending tests, pending care tasks, and other important updates. Then, at the end of every day, it can create a simple daily report for the hospital. The report can show how many patients were admitted, how many were discharged, how many patients had important changes, how many cases need follow-up, and which tasks are still pending. Instead of hospital staff spending hours collecting information from different systems, the hospital gets one clear daily picture. So the platform is not only helping one nurse or one doctor, it is helping the hospital understand what is happening across its patients, from one patient to the entire hospital. Now you may be thinking, is this idea really new? The honest answer is, not completely. Many healthcare technology companies are already working on different parts of this problem. Companies like Oracle Health and Epic are using AI to help doctors with clinical information and documentation. Abridge is working on AI that can help create clinical notes from conversations. In India, companies like Eka Care are building digital health records and AI-based healthcare tools. There are also companies working on patient monitoring and early warning systems. And hospitals already use hospital management software, electronic medical records, laboratory systems, and nursing systems. So we cannot say that nobody is doing this, but there may still be a gap. Many of these solutions focus on one part of the hospital workflow. Our startup idea is to connect these pieces around one simple question. What changed in this patient's care? Bring the information together. Create a clear patient timeline. Show the important changes. Give the doctor access to the original information. And help the hospital see the bigger picture. So the opportunity may not be inventing a completely new technology. It may be building a better way to connect the information hospitals already have. But there is one very important question. Can we trust the AI? Healthcare is not like a normal software product. If the AI makes a mistake, the result can be serious. What if it misunderstands a nurse's note? What if someone enters the wrong information? What if an important change is missed? What if the system gives too many alerts? Doctors may start ignoring the alerts. And what if a doctor trusts the AI summary without checking the original information? These are real challenges. So this system should never simply say, the AI says this is the problem. Instead, it should show the information behind the summary. Where did the data come from? When was it recorded? What changed? And what was the original observation? The doctor should always be able to check the source and correct the information. The AI can help collect, compare, and summarize information, but the final medical decision must stay with the doctor and the clinical team. Because in healthcare, technology can support care, but it cannot replace responsibility. Now let's look at the business side. Hospitals already spend money on software for patient records, billing, pharmacy, laboratory, nursing, and hospital operations. A patient care intelligence platform could work as an additional layer on top of these systems. Hospitals could pay a monthly or yearly subscription. The pricing could depend on the number of beds, patients, users, and the features they need. The platform could have different modules: nursing intelligence, doctor intelligence, patient timeline, AI documentation, hospital dashboard, and daily hospital reports. The goal is not to reduce the number of doctors or nurses. The goal is to help the existing team spend less time on repetitive information work and more time with patients. Now imagine the hospital of the future. A nurse updates a patient's condition. The information becomes part of the patient's timeline. The system finds important changes. The doctor gets a simple summary. The doctor checks the original information and then makes the clinical decision. The same information can also help the hospital understand what is happening across every ward. If this works safely and reliably, it could become a new intelligence layer for hospitals. Maybe the future of hospital software is not about adding more screens. Maybe it is not about creating more reports. And it is definitely not about replacing doctors or nurses. Maybe it is about making the information they already have easier to understand. Every day, hospitals create thousands of patient updates. Nurses record them, doctors review them, labs produce reports, machines generate readings. But someone still has to connect all of this information. What if software could help do that? What if a doctor could open a patient and immediately see what is new, what has changed, what needs attention? And what if the hospital could see the same picture across every ward? The technology may not replace the people caring for patients, but it could give those people something very valuable. More time to review, more time to decide, and most importantly, more time with the patient. Because maybe the future of hospital technology is not about replacing human care. Maybe it is about giving human care better information. And that is the real question. What if every patient had an AI care intelligence system? Thank you for watching. If you found this startup idea interesting, stay connected for more ideas that could shape the future.